Hi everyone, Dr. Jeff back with this week with co-op student Maya. And Maya, we did something exciting today.
Certainly we did. Dr. Jeff and I hit the skies today. We took off in a little airplane and had a phenomenal time. It was really cool. Saw the clinic from 3,000 feet.
Yeah,
it was awesome.
And I wore my flying socks just for the day.
Just for the day.
Yeah.
As did I wear my flying bumblebee socks. So we're looking good.
Yep. What are we talking about today?
Today we're going to be talking about ankles, and specifically ankle sprains. And so the most common type of ankle sprain is called an inversion sprain, and that's when you kind of roll your ankle inwards. And so this can happen in many ways, but to give you a few, one is you can just be walking and trip on a curb and your ankle will roll inwards. You can be playing a sport with someone, step on the opponent's foot, it's going to do that roll. And so we kind of give these three different gradings. The first one is a grade 1. This one you can kind of walk off. So it's not gonna hurt too much, you'll notice it, but nothing to really be too concerned about. Grade 2, you're gonna start noticing some bruising and some swelling, and it's gonna be painful there. And then grade 3 is a complete rupture of the ligament, and that's gonna require some orthopedic assistance.
Yeah. So in your ankle, you have ligaments. On the outside of the ligaments, when you're rolling, you're going to have the outside ligaments. You actually have 3 of them. The inside of your ankle, you have a big one called the deltoid. It's much stronger. The outside, you've just got 3 of them. One kind of runs from the tibia, the big shin bone, runs down onto your talus. And then from your fibula, the small bone can kind of run onto the talus, onto the calcaneus, and then to the outside. So you have the anterior, the lateral, and the posterior. Grade 1 sprain, you kind of roll your ankle over. What happens is, when you roll your calcaneus, the heel bone is going to kind of turn outside, the fibula is going to kind of roll down, and the talus is going to shift to the outside. So the whole thing kind of shifts because your body doesn't really want to tear a ligament unless it really has to. So it's going to shift those bones over. But people complain about, now I keep rolling my ankle over and over and over again. I have a weak ankle. And that's not necessarily true. What can happen is these bones will shift, and when they shift, if you don't get them back in the right position, you're already kind of half prone, you're kind of already turned over. And when we get people lie on the table and they point their toes up, we can kind of often tell you whether you sprained your ankle or not, because your toes are actually going to be rolled a certain way. And we'll say, hey, did you sprain your ankle? Yeah, a few years ago. Well, it's still not right yet. So the whole idea is we want to get these bones reset back in. And my years of helping with sports teams, sprained ankles, when people came out with sprained ankle with me and we were able to get that talus back, they're back playing the sport usually in 2 to 4 weeks. If we don't get that talus back and that calcaneus back, generally they're looking at 6 to 8 weeks. So it can actually cut your injury time in half by getting the talus and the calcaneus back in the right position. So with an ankle sprain, it's very important that we get in before it gets really swollen, get the talus and the calcaneus back in place. After the adjustment, generally you're going to find it feels much more stable, a lot more strength. Feels a lot better instantaneously. Like, as soon as we get that adjustment done, and the adjustment doesn't hurt. Kind of put you in the reverse, inversion type of position. And then we're just going to give it a yank. Nice little pop. And I actually have to do a little bit of the calcaneus here, so let's do that. There we go. We're good. I hope you enjoyed the video on ankle sprains today. It's one of these it's kind of like doing a rib adjustment. You kind of get instantaneously kind of feel better when we do the ankle adjustment. It feels really good. If you like the video, give us a big thumbs up. Share it with everybody you know.
Yeah.
And here at Goalsy Wellness, we got your back.